Hello, my name is Lauren Crockett, and I'm going to be speaking about childhood vaccinations in Michigan as well as in other countries around the world, as well as the United States. Some of the public health concerns in Michigan currently include the water crisis going on in Flint, Michigan, high levels of poverty in certain cities in Michigan, including the city of Detroit, industrial pollution from the power plants in Michigan, as well as childhood vaccination rates, which is what I'm going to be discussing. According to the Michigan Health and Hospital Association, due to low vaccination rates of children in Michigan, there have been numerous things, including low immunization rates, as well as the measles outbreak in Michigan and in other states currently going on. In August of 2019, Governor Gretchen Whitmer formed the Immunization Awareness Month in order to bring awareness to the problem of low immunization rates in Michigan, specifically, as well as other states around the country. Some research that has been done on low vaccination rates in children is one entitled Parents' Decision Making on Childhood Vaccination. In the study, researchers found that some children are not vaccinated or vaccinated late, and this is due to the parents' decision to not have their children vaccinated. And the goal was to find reasons for the parents' decision on not wanting their children to be vaccinated. This can include having trust toward authorities, including health authorities such as doctors, nurses, researchers, the perceived consensus and norms around vaccinations, the freedom of choice that they have regarding the option of getting their children vaccinated, the perception of danger of vaccinations, and the access to the information provided to parents about vaccinations, as well as the correct information provided to them. A review of the study is that they used a sample size of 222 people per country. All countries include Finland, Germany, Hong Kong, the Netherlands, Serbia, Slovenia, and Spain. The participants were 18 years or older and were a parent or guardian of a child of age 12 or younger. There were two parts to the study. The first part were with the parents, the 222 parents per country, and there was a questionnaire administered online. The questions were about vaccination and decision-making questions, and there was a total of 115 questions. The second part of the study involved two groups being compared. That was parents and non-parents. For the second part of the study, the non-parents matched with the parents based on age, sex, and gender. And the goals of the second part of the study was to find differences in numerous factors, including biased reasoning, differences in judging about involving decisions, and to find out if parents show higher understanding for other parents' decisions rather than the non-parents who had no children at all. Results from the study included finding a better understanding of parents' decisions to have children vaccinated or to not have the children vaccinated. And they found that the burden of immunity lies in the parents' hands. The research question presented in the study was, are there biases present for parents rather than non-parents regarding the decisions to have children vaccinated? And the hypothesis for the study was that parents do have the burden of social and perceived biases regarding the vaccination of their children, and therefore have a higher dilemma than non-parents do. The recruitment and enrollment process of the first part of the study included 222 participants from countries of Europe and Asia, and as stated earlier, they are 18 years or older with children under the age of 12. The second part of the study enrollment process included the same parents that were in the first part, as well as with 222 non-parents joining that part of the study. Some ways I would improve the recruitment process would be to recruit older adults with children, meaning that I would have adults well beyond the age of 18 in order to participate in the study, because they're more likely to make more understandable decisions and more likely to not follow any parenting trends that may be going on via social networks or social media. Something else I would include would to have a group of parents from the U.S. to be a part of the study, because the U.S. could also benefit from the research. And an example of this would be the measles outbreaks due to low vaccination rates in the U.S. The independent variables of the study was if the person was a parent or not a parent. And the instrument used to measure this is that they were physically taking care for a child under the age of 12 specifically. The dependent variable is a decision to vaccinate the child, and the instrument used to measure this was the level of health domain and level of involvement. Reliability was tested in this study with the help of the number of times that the participants were questioned, as well as being questioned compared to a different group. This allowed for the researchers to have very reliable information. Validity in the study included the questions asked. The questions were asked about health, about the knowledge that the parents and non-parents had about vaccines, the trust toward health professionals, whether they were open-minded or not, as well as hesitancy toward vaccines in general. The data collection process for the first part of the study included the questionnaire, which was given online. During this online questionnaire, introduction was given, consent was obtained, and demographic info was recorded. There were 115 questions about vaccinations and decision making. The parents were able to leave questions unanswered, and this questionnaire took approximately 25 minutes to complete. For the second part of the study, consisted of 3 experiments, all to find out biased reasoning, involvement, and solidarity. This was done via experimental situations and tasks. Each participant has 2 time slots in order to participate. And the participants had to make decisions, were presented with different dilemmas. And there will be an outcome from the decisions made. If I were to change anything about the data collection process for the first study, would be to not have the ability to have any questions unanswered, and also to involve questions about previous health determinants that the parents have made in their children's lives. Depending on what health conditions the children have been in, the parents may or may not be more susceptible to wanting to get their children vaccinated. For the second part of the study, I would have found more background information about the non-parents in order to get a better understanding of their decision-making processes and how they go about making their decisions in their everyday life. Thank you so much, and you have a great day.